Well, the $1 million question, adenomyosis. Most of the people who are asking what is adenomyosis is a type of endometriosis, but it is the endometrial lining of the womb is traveling into the muscle of the womb and it's diffuse. You cannot find a thread line, so you can say that this is the adenomyosis, I'm gonna take it. Sometimes you can find that in a form, what we call it a localized form, which is the easier form, which is kind of like the fibroid. But the diffuse type is that when you can find it everywhere in the muscle of the womb. You still have an option that we can, I swear to God, we can remove it by minimal invasive surgery, either by laparoscopy or keyhole surgery, minimal invasive surgery, or by even robotic surgery. It has many techniques and tricks because you cannot find the fine thread line, which you can say that this, I have to dissect at that level, because you will always find a level that you cannot dissect more because you cannot find a remnant that you can close it. For those who work really in adenomyosis surgery, they know what I'm saying. Even in open technique, the stitches are really hard to co-opt the edges at the end, and sometimes it breaks, so it has to have a plan. You should have a plan to co-opt the edges in a proper way, strengthen the muscles back again, with taking the maximum of the disease that you can take. There is many techniques that you can do. You can do that, and the most eminent surgeons in the world, they know that we have a problem with that disease. And there is people who are suggesting new modalities of treatment until we find a huge study, big study, who can talk about fertility, pain, and bleeding. That will gonna take a while, because we don't want it to be like the same techniques that have been done before and we could not find a clear solution or clear evidence-based medicine answer for that disease specifically. But the most prominent thing that I can find with my patients are they have a big relief of the pain and bleeding. Let's talk about fertility later on until we find out big results coming up, either in ACRM, either in ASHRI, either in RCOG, Royal College, or American College. Thank you so much.